Well, good afternoon, everyone, and happy Veterans Day. Welcome to Evergreen Talks for November 11th, 2021. I'm Brian Prowitz, and we're going to be hearing from Dustin Meyers, MD, here in just a couple of moments on today's edition of Evergreen Talks. We are on every second Thursday of the month at 4 o'clock sharp here on the Facebook and YouTube channels of Evergreen Family Medicine, where our physicians, providers, and specialists present topics that matter to you. One of the best things about this format is that we can see and hear from you live. So wherever you may be watching right now, you can have comments that will appear in our queue here, and towards the end of our broadcast today, Dr. Meyers can go through the questions that you might have. So we fully enjoy and encourage that kind of interaction, because it means that we have people watching and learning and asking more questions about the topic for today. So, Dr. Meyers, I'll let you introduce your Evergreen Talk. Thank you for your time today, and the floor is yours.
Thank you so much, Brian. All right, well, we'll get started. First of all, if there are any questions before the end of the presentation, if I'm going too fast, if something just doesn't make sense, then you can always raise that question, to chat with the question in case I need to back up before the end of the talk. But today I will be talking about the alternative options for pain management. Now, initially, this presentation was given to the chronic pain management group, one of our patient group events that we have at Evergreen Family Medicine. So it was tailored to a very specific audience. I expect today's audience will be a little bit more generalized, but I still think that this topic is relevant to everybody, because at some point, we're going to experience pain in our lives. Next. So the objectives of this talk are going to focus on more alternatives for pain management, separate from pain medications and other things that are traditionally used for pain control. So first topic is going to be talking about the role of physical activity in pain relief. And then we're just going to touch on stress management options and how that is used to help control pain. And then I'm going to just pick a few examples of supplements and other herbal therapies that have some evidence of providing relief with pain control, in addition to the more conventional medication therapies. And then I'll finish up just by talking about a few aspects of healthy nutrition and diet that will also help improve pain management, in addition to overall wellness in our lives. Next. Just a few disclosures for this talk. I will be showing pictures and examples of brands, trademarks, and other specific services. I'm only doing this for the purpose of just providing examples, not specifically endorsing any particular product or service. And then finally, I don't have any personal, financial, or other conflicts of interest to disclose. So we'll start off just by talking about a simple pathway to represent how pain works. And I'll use the example of somebody stubbing their toe. So you bump your toe, that would be the source of pain, that impact. Immediately, the nerve endings in your toe are going to sense that. They'll transmit a signal that goes through your nerves all the way to your spinal cord and your brain. And then in the brain is where you're going to register that sensation of ow, that hurt. So that's the pain signal. After that initial impact or trauma, a lot of times you'll also get a secondary inflammatory response, where even when you're done whacking your toe, the toe will become swollen, red, painful, and it'll ache, for some time after that. So that's kind of the secondary inflammatory response that's often involved with pain. So now you see in the green the common traditional therapies and medications to help with pain. And it shows along that pathway where each of these classes of medications work. So NSAIDs like ibuprofen, naproxen, those sorts of mostly over-the-counter medicines help with pain mostly through lessening the inflammatory response. And then some of your other prescription medicines like your SNRIs like Cymbalta, Effexor, and then gabapentinoids like gabapentin or Lyrica, those will actually help to block that transmission of the pain signal. And then other pain medicines like your strong opioid pain medicines or even Tylenol or acetaminophen don't actually help with the transmission of the pain or the pain source, but they just kind of block that registration of pain that we notice. And then on the bottom, you'll see some of the topics that I'm going to be talking about today and how those help to interfere with that pain pathway. You'll notice that these modalities tend to block the pain pathway earlier on, either by lessening the source of the pain or interfering.
Well, Dr. Meyers' computer seems to have had a glitch. We haven't had this happen before. This is live, so here we are. I'm going to give him just a moment to log back in again. Make sure if you have questions that you put them in the chat or in the comments if you're watching on Facebook or YouTube. And we will bring Dr. Meyers back here in just a couple of moments. This is Evergreen Talks, and we have an Evergreen Talk scheduled every second Thursday of the month. Dr. Shelley Britton will be on December the 9th, and then we'll hear from Dr. John Powell in January. So the next couple are also scheduled already for the next couple of months. But we'll get back to Dr. Meyers here in just a moment as soon as he's able to log back on. However, it's possible that his computer may have completely frozen, or maybe they lost power on that side of town. So we'll just give it another moment here and then decide what to do. But you are watching Evergreen Talks presentation of Evergreen Family Medicine, both on the Facebook and YouTube channels for Evergreen Family Medicine. Be sure to leave your comments although I don't think I can answer your comments right now. And probably if you had comments right now, I'd want you to hold off on them until Dr. Meyers gets back, because then he might be able to answer the questions for you. So stand by. All right. Well, Dr. Meyers' computer actually just sort of stopped in the middle of his presentation. So we're waiting for him to log back in and get his computer working again. And when that happens, he'll join us and we'll continue with our presentation here of Evergreen Talks from Evergreen Family Medicine. There we go. All right. All right. Are you ready to go, Dr. Meyers? Give me a thumbs up if you got me. I can't hear you, but I think you can hear me right now. Are you ready? Okay, great. All right. Well, you know what? Hey, that's proof that this is live. So it looks like you might have switched rooms to get to a computer that's working. So
my computer died on me, so we'll try this one. Can we back up a few slides?
yes.
I think, I don't know.
Let me get us back on track here.
Perfect. That'll do.
All right.
Hey, well, let's
Carry on, sir. Thank you for coming back.
No problem. All right. Thank you, Brian. All right. So let me just pick up where we left off. For those of you who didn't hear, we had some technical difficulties. I just needed to switch computers. So I was talking about the responses of alternative pain management therapies in the pain pathway. So what you'll notice is that these tend to have their effect earlier in the pain pathway, stopping the pain at its source or helping with the inflammatory process that keeps the pain going. Next. Thank you. Okay, now we'll talk about the first topic, physical activity. So you can actually go back. So hopefully when you think about physical activity, this isn't the first image that comes to mind. Climbing up 100-step staircase. As you'll see, exercise can be much more simpler and much more accessible to people in their everyday routine. Next. Okay, I wanted to start off just by giving some evidence to how exercise can help with pain management. So this was one large study that enrolled over 9,000 people. It was actually a meta-analysis that combined over 100 different trials with over 9,000 people to compare the effect of exercise programs versus the usual care received through a physician or primary care setting on the treatment of pain in patients with osteoarthritis. Basically, the conclusions were that after 8 weeks of exercise therapy, all of the different types of exercise showed benefit. The best modalities were aerobic and mind-body exercises for improving pain and function. But all the other forms like strength training, flexibility exercises also helped with all the measures of pain relief and functionalities. In addition, the aerobic and mind-body exercises were thought to have an additional impact on improving pain through their beneficial effects of improving sleep, mood, and pain sensitization disorders. Next. Okay, so this is a very busy slide. I don't want you to get bogged down in the details, but I just wanted to show some of the data from that major study. So if you look at one of these quadrants here, for example, the pain measurement in the upper left corner, you can see that on one side of the graph, it indicates the different exercise modalities that improved pain. And then on the left side, under the worst category, that would indicate, worsening of those markers for each different type of exercise. And so if you look at all those different measurements of pain, functionality, performance, quality of life, for every different type of exercise, they all showed improvement in these measures. So bottom line, as long as you're doing exercise appropriately, properly, it should provide some degree of improvement of pain and its related effects. Next. Okay, so I wanted to just give you a few examples of some exercises that are accessible to most people. So in the top left corner, that would represent water related activities such as swimming, water aerobics. And the reason this one is so beneficial is that even if you have severe arthritis, even if you can't walk, these are things that you can do that are going to offload the weight and the pain on your joints while still allowing you to be mobile and flexible. So any type of water-related activity is a great way to exercise, especially when you can't do those other things like walking and running or biking. The other thing that is helpful is just to use resistance exercises represented by the stretch bands pictured there. So these are easy because you don't need a lot of equipment to do them. You can purchase exercise bands, and then you can do almost an infinite number of exercises and work different parts of your bodies just through the resistance bands. And they're also very safe because it doesn't involve any heavy weights or any major risk of injury that you could use that could happen with other forms of exercise. And then the bottom left just represents aerobic activity with a focus again on low impact exercises. So a stationary bike, stationary elliptical, or other machines that work the cardiovascular system. And so whether you do that at home or are able to go to a local gym, those are good activities that are also easy on the joints. And then on the bottom right corner, that picture just represents chair exercises or even like chair yoga, because that requires even less equipment than the other forms of exercise. You can look up these things on your own too. I don't have any specific one recommendation, but you can go to YouTube, Google chair yoga, chair exercises, and you're going to find a ton of results that can be very easily performed within your own home. At the end of the presentation, I do list some links and resources, so you can also check out those just for some websites that I found that do provide a lot of good home exercises. Next. Okay, and then I wanted to provide a few examples of mind-body exercises. So these focus not only on the physical activity, but also have a component of relaxation or meditation that can provide additional relief for pain. So a lot of these are found within the different forms of Eastern medicine and Eastern activities like Tai Chi, yoga, and then aerobics in general, which is represented by the bottom right picture, is just a broad form of mind-body exercise that focuses on stretching, flexibility, and passive strengthening of muscles that, along with the other forms of mind-body exercises, will provide additional relaxation that helps with pain. So I just wanted to touch on those different modalities. And again, you can look at some of the links that I have at the end of the presentation, and there are a few websites that can kind of guide you in various mind-body exercises at home. Next. Okay. So the next topic would be stress management. And again, there's a wide variety of ways that you can help to manage your stress. This is how I do it. If you haven't guessed, that's me on the ledge of that rock there. So I enjoy getting outside of the office, going in the great outdoors, hiking, climbing, doing all that sorts of stuff. If you are into that, then that's great. If you prefer to stay inside, then there's plenty of relaxation exercise or relaxation activities that you can do. Next. This is just another mention of a study that helps to connect how stress management affects pain control. So this source estimated that from clinical studies, chronic pain as a stress state often induced depression, and up to 85% of people with chronic pain syndromes are affected by severe depression. Point being here, these two things are interrelated. Stress can make pain worse. Pain makes stress worse, and they unfortunately feed off each other. So you can't ignore either one. Next. And then just to illustrate that, this is a representation of the stress to pain cycle. So in someone who has chronic stress, it does a number of different things to increase pain. One pathway would be to sensitize nerve pathways. And so when you're just feeling ill and stressed, pain signals can occur for things that weren't previously painful. So just being touched or just sitting can actually become painful if you're under a great deal of stress. The other common pathway is increased muscle tension. So when you're stressed out, you tend to tighten up, and over time that can cause muscle spasms and reduce the blood flow to areas, which then worsens pain. And then another common pathway is that whenever you're chronically stressed, all the other health issues that can lead to pain also get worse. So things like fibromyalgia, irritable bowel syndrome, acid reflux, heart issues, all those can be worsened by stress, which then causes changes in the body that worsen pain. So again, the bottom line here is that we don't want to ignore chronic stress because that will impact the level of pain we can have. Next. Okay. And then I wanted to touch on a few modalities to help with stress management. So the first we've already covered would be exercise. Not only helping with pain, exercise is a great way to help with long-term stress management. Another great way is music. Music therapy can be done pretty much anywhere, listening at home or in a group setting. It's actually very powerful to help relax us, which again will help with pain control in the long term. The other thing that's very important is the sleep quality. If you don't get good sleep, your body doesn't get the opportunity it needs to rest and repair itself from all the activities done during the day. In addition, poor sleep is going to exacerbate a lot of other chronic health conditions, which again can lead to inflammation and through the exacerbation of chronic health issues will worsen pain management. And then the last example here I have would be managing stress through behavioral health intervention, such as counseling. So if there's a concern, with stress that isn't going away, I would encourage you to reach out to your provider, your doctor, or seek counseling on your own, because it doesn't make sense to let things go. If you're chronically stressed and it's causing you problems, there's no reason to live like that when there's help available. Next. Okay, and then I just wanted to provide a very quick example of a relaxation technique you can do at home. So this is called diaphragmatic breathing. I'll just walk through it very quickly. So what you first want to do is find a place that's calm, relaxing, that doesn't have a lot of noise or other distractions. Sit up straight. Make sure that your shoulders are back, so you're sitting up. Expand it out. Still feeling relaxed though. You can put your hand on your chest or on your stomach, and that just helps you to be aware of the actual breathing mechanism as you're breathing in to give you some feedback. And then step 4 would be to breathe slowly in through your nose. Hold for a couple seconds. Purse your lips, meaning close them slightly, but not all the way. And then breathe out slowly, and you can even push gently on your stomach just to help push that air out all the way. And then you would just repeat that. So this is just another very simple tool that you can do at home. just to relax. You can do it when you're stressed out, and it doesn't take that much time. Just a few minutes out of your day can help a lot. Next. Okay. And then that brings us to supplements and herbal therapy. So the first disclaimer that I have to give you is that whenever you see supplements that you would buy over the counter, you probably have noticed the statement on the supplement bottles. So supplements are different in that they are different from prescription medicines in that they are not evaluated by the Food and Drug Administration. They say the product is not intended to diagnose, treat, cure, or prevent any disease. Although the manufacturer usually has those intentions, but you just have to understand that they're not regulated the same way as other medicines. So you just have to be careful about the source that you get these things from. Next. And I'm going to give you a few examples. There are thousands of supplements out there, many more than I can mention today that possibly have a benefit in pain control. But I'm just going to give you a few that has some evidence of benefit with pain management. Ultimately, though, whenever you're considering starting a supplement, it would be best to check with your physician or your care provider just to make sure that there's no other interactions or other precautions that are specific to your situation and your health problems. Next. Okay, so we're going to start with turmeric. So this is also known as curcumin, which is the active compound in turmeric. So this is a spice. It's used for food purposes, but also has an anti-inflammatory and antioxidant effect. Most commonly, people would use this for arthritis or other chronic inflammatory disorders that cause pain. The dosing is very variable, but in general, you would start at a low dose, like 500 milligrams, and gradually work your way up, until you see a desired effect for pain. And then you do have to take them fairly frequently, up to 3 times a day, to have the maximum effect. Overall, very safe. The biggest limitation that people find is that because it's a spice, it can actually cause a little bit of upset of the stomach. So you just have to be careful with that. Next. Okay. And then the next supplement would be omega-3 fatty acids. So these are a type of fatty acids that are most commonly found in fish and some other vegetables. The over-the-counter supplements are generally derived from fish or krill or other types of seafood products. The doses are also very variable, 1,500 to 4,000 milligrams daily. If you want to do it the most natural way, though, I would just have you eat relatively small serving of salmon, 4 to 6 ounces, to have that same effect of those supplements. But you do have to do that on a pretty regular basis, on a daily basis, to really get the consistent anti-inflammatory effect. As far as side effects, most people don't have any serious issues. They can cause an unpleasant taste, unpleasant, fishy burp, and breath after consuming them. And then there is a very uncommon but possible effect of making you more prone to bleeding, especially when you combine them with other antiplatelets like aspirin and Plavix and blood thinners. So just make sure if you're taking those things that you talk with your provider before starting this. Next. And then I wanted to talk about Coenzyme Q10. That's a very common supplement that I often recommend to my patients. It is a fairly powerful antioxidant. It also helps a lot specifically with muscle cramps. What most people end up using it for is when they get muscle cramps associated with the statin medications that are used to treat high cholesterol and heart conditions. The coenzyme Q10 is made naturally in the muscles. It will get depleted with certain medicines like the statins. And so by giving this supplement, you just replenish what's lost. So in that sense, it is actually very safe because your body does make it on its own. Generally, the effective dose would be 50 to 250 milligrams a day in various forms, capsules, tablets, or liquids. And again, very minimal side effects. Next. And then Camphor is a topical preparation. Most people would recognize it through being one of the main ingredients in Vicks Vapor Rub. So this one is used as a topical anti-inflammatory and to help with muscle spasms. It's commonly used to help people relieve chest congestion and breathing as a completely separate indication, but it is also helpful for muscle pain. This is only used as a topical preparation. It is actually toxic if ingested, so please don't do that. But otherwise, aside from low risk of a topical allergic reaction, it's a very safe medication that has minimal risk when applied appropriately. Next. Okay. Probably most people have heard of capsaicin. It's known by the generic capsaicin cream or capsaicin brand. This is an extract from cayenne peppers. It does actually have pretty good evidence for pain relief, and it is known how it works. It depletes a substance called substance P, which is just another chemical that is involved in the pain transmission pathway, transmitting the pain signals along nerves. It also can help increase blood flow to the area, and so that can help with healing muscle injuries and helping with inflammatory pain. You do have to use it fairly frequently, up to 4 times a day over the area that's painful. The biggest downside is that because it's derived from cayenne peppers, it actually can cause a localized burning sensation. And that's the most common thing that keeps people from using it more. And then it can also exacerbate cough just because of that irritant effect from the cayenne peppers. Next. And then I wanted to mention alpha lipoic acid. So this is also a fairly effective supplement. It is an antioxidant, and it specifically is helpful for people with diabetic neuropathy and other nerve-related pains. The dose is generally effective from starting at 600 up to 800 milligrams daily. Overall, very safe because it is another natural substance that is found in the body. You just have to be careful, just like any supplement, that it could contain contaminants because the supplement is not as well regulated. But by itself, it's actually very safe and effective in many people. Next. And then I wanted to mention ginger. So that's another food product that can be helpful for a number of ailments. Most commonly, it's actually used to help with nausea, but it also has an anti-inflammatory and pain-relieving effect for arthritis. It comes in a variety of different forms. Capsules can be bought over the counter. You do have to take them fairly frequently, though, to have a lasting pain effect. Otherwise, you can use the fresh ginger or liquid extract. The downside to this one, similar to many of the spices, is that it can cause GI upset, especially when taken in larger quantities. Next. And then probably most people have heard of glucosamine and chondroitin. So these are commonly used for an anti-inflammatory effect for arthritis pains. These substances are used within the joint material itself. And so these are essentially building blocks that are thought to help replenish the joint cushioning and material in people who have damage to those areas. Dosing is about 1,500 milligrams per day for glucosamine, around 800 milligrams for chondroitin. Side effects are pretty minimal. Like most medications, they can just cause a little bit of nausea or diarrhea, especially at higher doses. And then because they are derived from shellfish, you should avoid them if you have shellfish allergies. Next. Okay. So again, before we go into the next topic, I just provided a few examples. There are tons of supplements out there. Many more that may provide relief of pain in certain individuals. So if there's any questions, about any other supplement that I didn't mention, I'd be happy to take questions at the end of this talk. But also, for your case specifically, I would just ask your doctor before you start any type of supplement. Okay, so the next and final topic is going to be nutrition, and I could spend all day talking about nutrition. So I'm just going to touch the surface just to give a few concepts and recommendations to help specifically with pain and inflammation. Next. All right. So first, what is inflammation? So it is this mysterious term that I've been throwing around. A simple definition would be it is the immune response that the body provides against injury, infection, and other insults to the body. It is actually a very complicated process involving a number of different chemical signals, different immune cells that cause the effects of inflammation, such as pain, swelling, redness, fluid buildup. So the benefit of inflammation is that your body uses it to fight infection and heal injuries. But what we often see is a maladaptive response in which putting the wrong types of foods and other chemicals in our bodies stimulates the immune response and inflammatory response because your body is trying to get rid of them. Your body thinks it's a foreign substance, and so it tries to fight it off. Normal metabolism of eating foods does cause certain foods causes free radicals, which are basically waste products from the food metabolism that can damage the body's cells. So this, to some degree, is a normal process. But when inflammation becomes higher and more extensive, that's when we really notice it as pain and other ailments. Next. Okay. So hopefully your diet does not mostly consist of these foods. So this is just a picture representation of foods that are commonly inflammatory in the body. So we see a lot of wheat products, such as the donut, a lot of red meat products like the hamburger, the hot dog, and within those preserved meats, we have a lot of preservatives like nitrates and other sodium, MSG, things like that cause an inflammatory response in our body. The other major ingredient in these types of foods is sugar. So sugar is very inflammatory to the body. You can tolerate a small amount of sugar, but unfortunately with the typical American diet, we consume a lot more than the body is meant to handle. And that leads to inflammatory problems in addition to all the other health issues associated with sugar, like diabetes, obesity, heart disease, etc. Next. All right. So how do we prevent this? How do we fix the problem with inflammatory foods in our diet? This is where antioxidants come in. So to define antioxidants, I took this from Medical News Today. They have a good short description. So antioxidants are substances that can prevent or slow damage to the cells in the body caused by free radicals, unstable molecules that the body produces, and can help the reaction to environmental and other pressures that are put on the body. So in quick terms, antioxidants reduce the damage that is caused by inflammation. Next. So hopefully you recognize some of these foods. So these represent just a handful of the foods that are rich in antioxidants and can help fight inflammation. So the common categories that we see would be vegetables. So all the different colors. You see some celery, so the green vegetables, some spinach, various herbs like basil, peppers, tomatoes. So if you're looking for vegetables, I would get a variety of all the different colors, because they have different antioxidants, different vitamins and minerals that are helpful and that your body needs. The other major category shown here would be certain fruits. So especially the berries, such as blueberries, cranberries, not pictured there, but blackberries. Almost all the berries are rich in antioxidants. The other benefit to them is that they have higher amounts of fiber and less sugar than some of your other fruits. And then other groups of foods that are beneficial in general would be the healthy fats. So you see an avocado there, you see a few tree nuts scattered there. So all of these are going to be rich in unsaturated fats, which are the less inflammatory types of fats that are good for your diet. You also see citrus fruit. You also see various spices, I believe ginger and a few other vegetables like root vegetables, ginger, onions, etc., garlic, that are anti-inflammatory and rich in antioxidants. So again, just a few examples of the types of foods to look for in your diet. Next. Okay. So again, I just barely touched the surface of the dietary recommendations and tips to help with inflammation in your body. The brief summary: try to cut out the sugar, cut out the artificial sweeteners too, because those are also unnatural and unnatural substances that can cause inflammation and other side effects in the body. Try to decrease the red meat and the excess saturated fats, because those types of fats and other substances in those proteins do cause inflammation and can cause other long-term health issues. Try to instead increase the amount of unsaturated fats in your diet, such as the tree nuts, the avocados, the olives, olive oil, and those types of foods. Increase antioxidants, increase fiber intake as well. Not only for the benefit of inflammation, but for weight management, for feeling better, and giving your body the nutrients that it needs. Next. Okay. And that mostly concludes my talk. Again, I touched on just the surface of the different modalities that can help augment pain relief and general well-being. So I would ask of my audience, from the information given in this talk, that you just make a few small goals, for example, one in each area that we discussed, that would help your health and help you to be more well. So maybe one small nutrition goal, one small goal to help you be more active, and another goal just to make yourself relax and deal with stress better. You won't regret it. This is just a picture, again, of what I do to make myself well and relax. But there's a lot out there that you can do that'll make you feel good. So with that, I conclude my talk, and I will answer any questions that you have.
Well, I have a question for you right off the bat. What are we looking
Sure.
at here? Where are you?
Yes.
Huge Rock.
Yeah, so this is actually Harpers Ferry, West Virginia. It is a very historic town if you know much about the American Civil War. This is actually the location where I did my medical residency training. So after long days at the clinic, I would often go for a run, cross the bridge over the Potomac River, and overlook the town of Harpers Ferry.
Okay.
Beautiful place if you ever get a chance to be in that side of the country.
Terrific. Well, let's take a look at a couple of questions that have come in here. I'm going to take your presentation down off of the screen here. We have a couple of things. The first one is, how can people find more resources or examples of some of those exercise options that you talked about?
Oh, actually, I'm glad you brought that up. You may actually want to bring up the presentation again, because I think the last slide would have some of those resources, I believe. So if you can just put that there you go, references, and I think there's actually another page, so maybe in 30 seconds you can kind of scroll back, just so people can look at those, take a photo picture of that in case you want to look at those. Mm-hmm. But the other good way, other than these online resources that I listed, would just be to ask your healthcare provider, if there's any community resources. A good resource that we have here locally would be the YMCA. So if you're a member of that, or any other health-based organization and fitness center, a lot of those people are experienced in providing resources. And again, the simplest thing, if you've got internet access, Google is powerful if you know where to look. So just YouTube, Google chair exercises, home yoga, seated exercises, and you'll find a lot of stuff come up just by searching online.
Okay. And then we have one other one about supplements. So you kind of scratched the surface, I think. I'm sure there are probably a lot of supplements you can't get them all.
Yes.
So I'm asking a little bit more about where maybe some more information or others that you would recommend. It seems like this would be very specific to whatever the issue might be a person was interested in a supplement for.
Yeah. So the best answer, just because it's hard to make specific recommendations unless I know much about you. It's going to depend a lot on the type of pain you have, the type of other health conditions you have, the other medications you're taking. So the best way to get an individualized recommendation would be to reach out to a healthcare provider that knows you. So your doctor, your primary care provider, pharmacist, if you know your pharmacist and they have time to talk with you. Those are all good recommendations, especially for a lot of the over-the-counter supplements and other over-the-counter medicines that you can readily get without a prescription.
Terrific. And should people be careful about just starting on supplements? Because you know how it is. You see a thing or somebody tells you this is the good thing to take. And I mean, it potentially could, I would think, mix badly with your current medication.
Yeah.
Sort of be careful about things, it sounds like.
Absolutely. So I can't stress that enough. Most of the supplements out there, when taken properly, in the right doses, are going to be pretty safe. However, supplements are just like the prescription drugs that you get, other than it's just less regulated. So the best advice would be do your own research, find names of these supplements, but before you start taking them, before you start spending money on them, ask your healthcare provider who knows you, who knows your medications, knows your health problems, just to run it by them, before you start something new.
Yeah. Terrific. Well, thank you, Dr. Meyers. Appreciate your time and all the effort that you put into your presentation on pain and how to deal with it, alternative options for pain management. Everybody can also visit evergreenfamilymedicine.com for newsletters, more information, contact information for various doctors, what to do if you're trying to find a provider. Lots of information that is available at evergreenfamilymedicine.com. And this is an Evergreen Talk every second Thursday of the month at 4 o'clock. Another provider from Evergreen will be here to talk about an issue that we hope matters to you. Shelley Britton is up next in December, and then we'll see Dr. John Powell later in the series. And so if you would like, you could suggest maybe a topic that you would like to find out more about. Send that to somebody there at Evergreen, or you could post something in the chat comments right here as well. So, Dr. Meyers, thank you so much for your time. Happy Veterans Day, and have a good weekend.
Absolutely. Thank you, Brian, and thank you, everybody, for joining us today.
All right. We'll talk to you again soon.
All right.